Our third and final consultation roundtable as part of our Delivering Prevention in an Aging World program sought to understand from key stakeholders how can we use technology more effectively to deliver prevention across the G20. Our consultation paper highlighted that technology can actually help deliver prevention by improving population health through the use of big data to develop targeted preventative health strategies and improve health outcomes. It can support healthcare delivery in particular by providing electronic health record systems and a wide range of online health services to deliver better and more efficient preventative advice and care throughout people's lives. It can also help to connect individuals to preventative health care by overcoming distance barriers and enabling people to live independently for longer. And finally, it can actually help to empower individuals to take control of their health and improve their health and well-being by supporting their health literacy. We asked our stakeholders several questions that cut across these key areas. The first of which was how else can technology be used to help deliver prevention? And one of the key findings from this discussion was that we need a prevention strategy that maps out how technology might be able to deliver it. So making sure that we actually understand the role of technology in helping to deliver prevention is really important. We asked our stakeholders, who do we need to influence to maximize the potential of technology in delivering preventative health care? We need to influence public sector, private sector, NGOs, academia, and affected communities to articulate what the health innovation gaps are, what health areas need to be prioritized, and what needs to be designed to meet the requirements of patient populations. We also need to be selling the idea of technology to the general population and to all politicians, as many remain largely unconvinced. We also need to be thinking about bringing cellular providers to the table. When we talk about technology, we often don't talk about accessibility. Those in resource-poor settings, those in rural areas might not have access to a cellular service and Wi-Fi. So ensuring that we're widening access by bringing the right people to the table is really important. And we also have to make sure that the right reimbursement structures are in place. For example, in South Africa, telehealth has largely failed because healthcare providers weren't incentivized to use it. We asked our stakeholders, how can we tackle the digital divide and ensure technology doesn't exacerbate or create new health inequalities? Our stakeholders said that we must make all technology easy to use, for example, having a one-stop shop or making it self-installing. We also need to prioritize good tech literacy in schools and encourage good health literacy across the life course. We must also ensure that people have access to the appropriate devices and that tech needs to be built for the devices that people do have. And again, this idea that we need to ensure that the right tech infrastructure is implemented and offered for those in resource poor settings, those who are in low income settings, it was a reoccurring theme. And we also need to ensure that we incentivize companies to deliver inclusive and low-tech solutions. So, for example, having a competition could be really a great way to incentivize. Tax breaks could also help tackle the digital divide. Telemedicine itself could be leveraged in advancing clinical trials so that patients aren't excluded from trial participation simply due to distance barriers. And of course, user-led design from the start will, of course, help reduce health inequalities and improve adherence. We also need to ensure that e-health records are patient-centered. We asked our stakeholders then, how can we address data privacy and misuse concerns? And how can we give individuals greater control over their data? Our stakeholders said greater transparency and consent processes are absolutely needed. We also need to put the control of data back into the hands of consumers. We need to be transparent with the process, enabling people to have choice about their involvement and make sure that people have control over what information can be shared. We asked, how can we deliver interoperability? And our stakeholders said that to do this, we need demand from the people. COVID-19 in particular has caused every country to reassess its data and surveillance capabilities and to think about interoperability to share information globally. We need to build on these successes and the advances that we've seen over the past year to be used in all health areas moving forward and to support delivering prevention. We also need to be addressing the governance structures which allow different health services to contact one another. And we also need to focus on interoperability between health and care and linking clinical records to other public areas such as transport and housing. We asked our stakeholders, how can we ensure technologies are successful when implemented? How can we ensure they actually, deliver their potential? Trust in healthcare was seen as really important, as this would lead to greater acceptance of technology. We also need to move to a problems-led approach, ensuring that technology is actually solving health problems rather than trying to sort of retrofit them to the problem. So in a sense, we need to sell the idea, not the technology. And we need to understand people's behavior. We need to encourage them to take up technology. So how do we incentivize them? How do we motivate individuals to change? Some suggestions our stakeholders highlighted was having coaches or a community that can help to reinforce behavior change and ensure people take up these technologies. We also could demonstrate to individuals that technology is relevant to them, making it clear how it can actually help to prevent a health problem that they have. So making it very personal to them. We also need to engage trusted community members such as care workers and other people who are likely to reinforce behavioral change. We also need to improve the visibility of products and services and trust in them. We could invest in information campaigns so people are aware of the technology that is out there. A lot of technology tends to fail when it goes out to market, and one of the reasons is because people just don't know about them. For example, we could also give annual subsidized access to validated and trusted products and services, but we need to make sure that this offer is part of people's routine activities. For example, having the offer available at the same time as tax returns so that people remember and take advantage of the offer. We also need to make sure that healthcare professionals are trained in using technology. We know that technology always has some level of human involvement, but we need to make sure that people running the tech are properly supported. For example, there's no point in being able to email your physician or healthcare provider if you have to wait 3 weeks to hear back from them. Healthcare systems often expect individuals to change and adapt to service innovation, but really what we should be doing is we should be focused on how to adapt services to the needs of individuals. And we need the right business models that are going to allow us not only to adopt new solutions, but for them to be scaled. We finally asked how can we measure whether a technological intervention is cost effective, and how can we get better at measuring cost effectiveness. And we need to, again, this idea that we need to sell the idea rather than the hardware will ensure that that interventions remain cost effective and that they work. We also need to implement a ranking system of which technologies are most cost effective. We also need to be planning in advance to the point where you can be confident the technology will work. So don't do a limited term pilot, because if you do, it will ignore the required behavioral change. So the bit that actually generates the health benefit. So there were a lot of really interesting points raised by our stakeholders, and moving forward in our program, what we'll be doing is trying to consolidate all of this information and come up with some really tangible and helpful solutions and recommendations moving forward for countries across the G20. Thank you.